Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
All right, welcome back to the deep dive. It's wild, but back in 2020, nearly 70% of smokers thought that vape could help them quit.
70%? Wow.
It's a really common belief. But you got to ask, what does the science actually say? Does vaping really help you kick the habit?
Yeah, that's a huge question. And it's exactly what we're diving into today. We're looking at the relationship between vaping and quitting smoking. And you sent us this fascinating health news article from March 2025 and the research paper behind it, both from experts over at UC San Diego.
And they really dig into whether vaping actually works. So let's break down what this study was all about. What were the researchers aiming to uncover?
Well, they were interested in the link between vaping, both daily and just occasional vaping, and how successful people were at quitting cigarettes over a longer period of time.
Go ahead.
This was with adults in the U.S., but they didn't stop there. They also wanted to see if vaping helped people quit all tobacco products altogether.
Not just cigarettes, but everything.
Exactly, including e-cigarettes.
So like going completely tobacco-free.
Yeah, that was a key part of it.
That's super interesting. So how'd they actually go about doing this research? What was their approach?
So they used data from this big study, the Population Assessment of Tobacco and Health Study.
Right.
They focused on smokers from 2017 and followed up with them in 2021.
A 4-year span.
Right. And within that group, they had daily vapers, non-daily vapers, and those who didn't vape at all.
Okay, so 3 distinct groups.
Yeah.
But how did they make sure it was a fair comparison? Because you could imagine people who vape might be different from those who don't in other ways.
That's a great point. They used something called propensity score matching to make sure the groups were comparable.
Propensity score matching, that sounds pretty complex.
It is, but think of it like this. Let's say you're comparing 2 basketball teams. One team has a lot more tall players. If they win more, it might be because of their height advantage, not their coaching. Propensity score matching is like evening out the height of the players across the teams, so you can really see if the coaching is making a difference.
Oh, I see. So it helps isolate the specific effect you're looking at.
Exactly. In this case, they used it to match smokers from those 3 groups based on 14 different factors that can affect quitting success.
14. That's quite a lot. What were some of those factors?
Well, things like how motivated someone was to quit, their income, age, education, also their smoking habits, like did they smoke daily or not? Was their home smoke-free? Had they tried quitting in the past year?
Well, that's comprehensive.
And even things like their perception of cigarette harm, insurance status, mental health symptoms, whether they had a smoking-related disease. Oh, and their racial and ethnic background as well.
So by matching them on all those factors, they could focus specifically on the role of vaping.
That's the idea, to really zero in on the impact of vaping itself.
Makes sense. So after matching everyone and analyzing the data, what did they find? What were the main takeaways?
Well, let's start with just quitting cigarettes. Among daily vapers, about 21% had quit cigarettes for at least a year by 2021. But here's the catch. When compared to their matched group who didn't vape, the quitting rate was actually 4.1 percentage points lower for those who vaped daily.
So if vaping daily didn't seem to help, maybe even slightly hurt their chances.
Right, but that specific difference wasn't statistically significant.
Meaning it could have been due to chance.
Exactly. However, for the non-daily vapers, their quitting rate was 5.3 percentage points lower than their matched counterparts, and that difference was statistically significant.
So occasional vaping seemed to make it harder to quit cigarettes.
Yes, and when they looked at quitting all tobacco products, cigarettes, and e-cigarettes, the results were even stronger. Daily vapers were 14.7 percentage points less likely to be tobacco-free compared to those who didn't vape.
Wow, almost 15 percentage points. That's a pretty big difference.
It is, and it was statistically significant. Non-daily vapers also had a lower rate of quitting all tobacco by 7.2 percentage points. Again, statistically significant.
So regardless of how often people vaped, it didn't seem to help them quit tobacco altogether, and might have even made it tougher.
That's a key takeaway. This study challenges the idea that vaping helps you quit. The results show that at a population level, it doesn't increase the likelihood of quitting cigarettes and might actually hinder it, especially when you look at long-term abstinence from all tobacco products.
It seems like the idea of vaping as a helpful tool is being debunked by this research.
It really does raise questions. And another significant finding was that vaping, whether daily or not, could actually prolong nicotine dependence. Many participants who vaped were still using e-cigarettes, even if they had quit traditional cigarettes.
So they were still hooked on nicotine, just through a different method.
Right. And the researchers emphasized the importance of these findings for public health policy. They pointed out that the potential for marketing e-cigarettes as a cessation aid, especially to younger folks, needs to be considered really carefully.
Especially given the potential for addiction. Now, it's important to acknowledge that every study has limitations. Did the researchers point out any limitations of their work?
They did. They mentioned the possibility of something called residual confounding.
Residual what?
Confounding. It means that even though they controlled for a ton of factors, there might still be other unmeasured differences between the groups that could have skewed the results.
Oh, so like hidden variables that they couldn't account for.
Yeah, and that's always a possibility in observational studies like this.
Right, you can't control for everything in the real world.
Exactly. They also pointed out that they didn't include certain factors in their initial matching, like changes in cigarette dependence after someone started vaping.
I'm curious, why not include those?
Well, those changes could be seen as steps on the path between vaping and quitting, and including them might mask the true effect of vaping itself.
So it's about making sure they're isolating the specific effect of vaping.
Exactly. They also mention an assumption they made. They assumed that most daily smokers who switched to vaping didn't reduce their cigarette smoking because of the vaping.
Okay, that's an interesting assumption.
It's reasonable, but it's worth noting because it could influence the interpretation a bit.
Makes sense. Now, what did the researchers themselves have to say about their findings? Any interesting quotes?
Well, Dr. John P. Pierce, one of the authors, said, and I quote, "Most smokers think vaping will help you quit smoking. However, this belief is not supported by science to date. We studied quitting success among both daily and non-daily vapers and came up with a quite definitive answer."
Wow, that's a pretty strong statement.
It is. He emphasized that quitting success was actually lower among both daily and non-daily vapers compared to similar smokers who didn't vape. Dr. Karen Messer, another author, also highlighted how important it was to compare similar groups, using the phrase like with like.
So making those accurate comparisons is crucial.
Yes, and she emphasized that their analysis was designed to be definitive by carefully controlling for all those other factors. She added, and I quote, "Misleading associations between vaping and smoking cessation routinely occur unless confounding characteristics are carefully accounted for."
So without that careful control, you can get the wrong conclusions.
Exactly. And Natalie Quach, the first author, stated that while there's still a lot to learn about vaping, what we do know is that the idea that vaping helps people quit isn't actually true. It is more likely that it keeps them addicted to nicotine.
It sounds like the researchers are pretty clear that vaping is not an effective quitting tool.
And they also mentioned that while e-cigarettes might not have the same immediate harmful chemicals as cigarettes, they're not harmless either.
Right, we still don't know the long-term effects.
Exactly. And Dr. Pierce highlighted that the long-term health consequences of vaping over decades are still unknown.
So this deep dive has really shed some light on a complex topic. If vaping isn't the answer to quitting smoking, then what is? What can really help people achieve long-term, nicotine-free lives?
That's the million-dollar question. What other strategies and support systems are out there? What evidence-based approaches can we explore?
And how can we better understand and address the complexities of nicotine addiction?
Absolutely. And we hope this deep dive has sparked some thoughts and questions for you. We encourage you to dig deeper into the sources we've discussed and critically evaluate any information you come across about vaping and quitting smoking. It's a conversation that needs to continue.
Thanks for joining us on this deep dive. We'll see you next time.
See you then.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.